Hello everyone, welcome again to my channel. I am Dr. Zina. Today we'll be talking about what is dry socket or alveolar osteitis. But before we continue, make sure to smash the subscribe button down below because it would really help me to do more and more videos. Now, as the name suggests, dry socket. So it is dry from the inside. Why? It is an empty hole inside the socket where the blood clot does not form. So since there is no blood clot, means that it's dry. As you can see in the picture, it's dry. There's no blood clot formation taking place. So that's called dry socket or alveolar osteitis. It happens immediately after extraction. Here's a picture showing how the dry socket look like. As you can see from the picture, after we extracted the third molar, the socket is still open. So when the patient he eat anything, the food will enter inside the socket, and this will cause a severe pain for the patient. And this condition is referred to as the dry socket. Commonly seen more in the lower teeth than the upper, and females more. Why is that? Because of the estrogen levels. As you can see in the picture, the first molar, after we extracted the first molar, the socket is still open and there's no clot formation taking place. So this condition is referred to as a dry socket. Since the socket is open, so whenever the patient he eats, the food will enter into the socket, and this will cause a bad taste inside the mouth, which is referred to as the bad breath or halitosis, and he will end up having a low-grade fever and an empty socket, obviously, with no blood clot formation, and a very, very severe pain that is 1 to 3 days after extraction. So immediately, either the pain he will be having immediately after extraction, or the second day you will have a very severe pain, or the third day you will have a severe pain. So day 1, 2, 3 severe pain, immediately the diagnosis will be dry socket, and also a pain that will be radiating on the side of the removed tooth as well. Now, what are the risk factors if we did a difficult tooth extraction for the patient? So we cause trauma to the patient. This trauma, it will obviously cause a dry socket for the patient. Or if the patient, he is not brushing his teeth well and he's not rinsing, etc. So patients with poor oral hygiene. And also if he is not following our post-surgical extractions, our post-surgical instructions after the extraction, or for the female patients who are taking oral contraceptives as well, it can cause dry socket, or drinking through a straw after the tooth is removed. That's not a good thing. Or if you had a dry socket previously in the past, you will more likely to have a dry socket again. And if we did extraction and you spit the blood after extraction, that's not a good thing because the blood helps in healing. And if you spit the blood, there's no clot formation. So we ask the patient to come to us and we will do irrigation inside the socket with the chlorhexidine. And then we will need to pack the socket with an alveo gel. Finally, we need to do suturing, very good suturing. Here is a picture for the alveo gel that will be applied inside the socket. The active ingredient for the alveo gel is eugenol. Eugenol is an analgesic, and this bad taste that comes from the alveo gel, this is because of the eugenol, which is tree-based analgesic. So it provides immediate relief for the patients with dry socket. For 24 to 48 hours, they will have a good relief, and then the pain will go afterward. You can prevent the dry socket from taking place by following our post-surgical instructions, and no smoking for 3 days at least, and avoiding drinking carbonated or warm beverages. Do not drink anything hot in the first 24 hours, and stop drinking from a straw because it will not allow clot to form, and this will result in dry socket.